Welcome to Kalusugan ay Karapatan. We are pleased to bring to you another important episode, Kaya Ko Ito, I Can, breaking myths of differently abled, autistic, and ADHD Filipinos. Good day to my lively co-host, Dr. Lily.
Good day to you, Chancellor Menchit, and good day as well to our viewers. Yes, our episode today will shatter some false beliefs about autism and ADHD, or attention deficit hyperactivity disorder, one of the most common neurodevelopmental disorders in children.
As a pediatrician myself, I know that the diagnosis of autism or ADHD is usually made in childhood. However, some symptoms may persist as the child gets older and reaches adulthood.
You know, I did a little research on this and I found out that in October 2016, according to the U.S. Center for Disease Control, 11% in children 4 to 17 years of age and 5% of all children have ADHD. I'm also surprised to know that ADHD is more common among boys, about 13.2% than in girls, about 5.6%. The average age of ADHD diagnosis was 7 years of age, but children with more severe ADHD were diagnosed earlier.
Maybe our resource persons can tell us later why the statistics are like this and whether these are also true for the Philippines. I'm sure our viewers would like to ask the question, how do we know if a child has ADHD? Well, the symptoms are difficulty in paying attention, difficulty in controlling impulses, and being very active. Also, there are other indications that one is suspected to be autistic. So let's enumerate some of them, Dr. Lily.
Number one, your child often fails to give attention to details or makes careless mistakes. Two, your child often has trouble remaining attentive to tasks or play activities. Three, your child loses focus and fails to finish schoolwork or chores or has trouble being organized. Four, your child often loses things necessary for tasks and activities, such as school, materials, pencils, books, etc. Your child is often excessively distracted and often forgetful in daily activities. Your child often fidgets with or tap hands or feet, or squirms in his or her seat, or leaves the seat in situation when remaining seated is expected.
Your child often runs about or climbs in situations where it is not appropriate and is often on the go, acting as if driven by a motor. Number 8, your child often talks excessively. Number 9, your child often has trouble waiting for his or her turn and often interrupts or intrudes on others, such as butting into conversations or games. And 10, your child has had several of these symptoms before the age of 12 years and has had several symptoms in 2 or more settings, such as at home, the school, or work. Number 11, your child's symptoms interfere with or reduce the quality of social, school, or work functioning.
There are so many symptoms, Chancellor Menchit, but how do I know if what I see is ADHD if I observe only 1 or 2 of these symptoms? Can I say a child is already suffering from ADHD if a symptom is observed once or twice?
That is the reason why we have resource persons today who will help us understand autism and ADHD. We are happy to say that one of our special persons is no less than the Secretary of the Department of Health. You know, when I asked her for a name from the government who could come and join us in this session, she easily volunteered to be one of the resource persons because it is her new advocacy. Our guest has been a public servant for 27 years and has served 13 health secretaries. She rose from the ranks from voluntary health work in Kidapawan to Assistant Secretary and Deputy Head for the Office of Health Regulations to her current position as DOH Secretary. With her vast experience, she has led and became the leader and champion of Kalusugan Pangkalahatan, with advocacies in mental health, women's health, tobacco control, among others, and many more children's health. Our resource person is a fellow UPian, from UPIS and Zoology Department of UP Diliman, UPPGH College of Public Health. Ladies and gentlemen, we are happy to introduce the Secretary of the Department of Health, Dr. Pauline Jean ROSELL-UBIAL.
Yes, good day to all of you. Good day, Chancellor Menchit and Commissioner de las Llagas.
Our secretary will be joined by another important resource person, a developmental and behavioral pediatrician, an expert in child protection. She's a clinical associate professor at the Department of Pediatrics, College of Medicine, and of UPPGH, Associate Director of the Child Protection Unit of UPPGH and the head of Center for Developmental Pediatrics at the Medical City. She is a true blue UPian, being a graduate of UP Integrated School as a valedictorian, BA Zoology as summa cum laude, and the UP College of Medicine class of 1987 as one of the top 20 graduates. She's advisor to other professional societies and support groups, which she helped set up, like the ADHD Society of the Philippines and the Philippine Association of Behavior Analysis. We're proud to introduce Dr. STELLA Manalo.
Good day to everyone, to Secretary Pauline-UBIAL, who's a classmate from high school and a batchmate in internship sa UP, and Commissioner de LLAGAS and my Chancellor Menchit Padilla.
So let me start the first question, Dr. Stella. Can you help us distinguish, differentiate autism from ADHD?
Yeah, they're two very distinct and different conditions. However, if you're looking from the outside, you tend to mix up the two, okay? But the difference being that if you have autism, your brain is really wired differently, meaning you understand the world and you learn about the world in a different way. Ang ADHD, these children are more neurotypical. They have normal social skills, normal interactions. It's just that they have a high level of hyperactivity, but the most compromising problem that they have is inattention. Now, some people have ADHD, and when you look at them, they look very normal because they're just inattentive. They have an inattentive presentation. And earlier, the characteristics that you gave about how a child with ADHD is, that is the diagnostic criteria for young children. But the presentation of ADHD changes over the lifespan. So that's a big debate actually, yung mga conditions na yan. It's only for young children because adolescents and adults present differently.
So how do they present, Dr. Stella? For the older ones, for the adults?
Well, it really depends if they've been managed early, because adults who have been managed early with their ADHD, they're very normal. They can live a very normal life and they're excellent in their field of work. The problem is those who are not diagnosed and helped through childhood, they're at higher risk for mental health problems. And, you know, hindi na-tap yung potential nila because of difficulties learning. So they're the underachievers. Yung sinasabi natin, they're street smart but maybe not school smart. And those who, despite apparent intelligence, don't perform as well in the school setting. And even if they're intelligent, pang adults, they're restless at work. So minsan yung characteristics nila, they keep on changing jobs. They're never satisfied. They have an inner restlessness, but everything else, they're very normal.
Okay, so we're saying that we see them out there, both those with autism and ADHD. But do we have numbers? Let me start with Secretary Ubial. Do we have statistics on patients with autism and ADHD?
Actually, we tried to get a registry going for persons with disability. So those with autism and ADHD, and including physical as well as other mental disabilities. But unfortunately, the WHO actually estimates about 10% of the population have disabilities, but we only get about 2% in the registry. And then some years ago, we tried to get a prevalence study going, particularly in the Visayas for autism. But we got only one for every 1,200 children that were examined. So that's very, very low compared to, let's say, the United States. It's one in every 68 children. But in Korea, I think that's the highest rate. It's one in 58 children. There's a registry that the private sector have, but we actually have not collated it because it's really not showing us the true picture, because we don't detect all cases. So if you look at the private sector, there's a bias for those who are able to pay or are in the upper socioeconomic class.
That's true. There's a stigma to being identified nowadays. So there are many out there who may have these conditions, but they'd rather not be identified. So our statistics will really be based on those who come to have themselves diagnosed. And even our society, we have a society of developmental and behavioral pediatricians. We really can't get a registry going because the problem in the private sector is they also go doctor hopping. Yeah. They go from one doctor. So if we cannot count, it's one person may be counted 5 times, because there's this confidentiality issue that we don't want to put their names out there. So we're still trying to devise some way such that there will be a registry. But I think soon this will become a possibility in detecting how many children with disabilities we have, because the DOH has a project that's coming up. Well, we're coming up with a registry, pero it's an imperfect registry. Pero I think because PhilHealth will soon be covering for disabilities, it'll be the assessment and the therapy will be covered by PhilHealth. It will be an incentive for families to have their children diagnosed, and maybe Secretary Pauline can elaborate on this project of the DOH.
Yes, actually we signed a benefit package for children with disabilities last February, and we're rolling out this benefit package to nationwide, so that it covers actually the cost for screening and diagnosis of children with disability, and hopefully with that, shall we say, incentive to get diagnosed, then we can get a better picture of what the autism and ADHD, as well as other disabilities among children, the prevalence in the country. So hopefully after about a year, we can have a more solid frame and a more solid data on the prevalence in the country.
Can you share with us some data from the Philippine General Hospital?
Yeah. Our general clinics in PGH, for the Pediatrics Department, we see around 1,200 to 1,500 children a year. And every month we have this audit and statistics. And for the past 10 years, every month, in the top 10, we have the diagnosis of autism, ADHD, global developmental delay, and speech delay. So these are 4 developmental problems that always appear in the top 10 of the outpatient consults in UPPGH. And for the section of developmental and behavioral pediatrics, we also have 1,000 to 1,200 consults a year. And out of this, 30% have autism. Another 30% have global developmental delay or intellectual disability. And the rest is a combination of other developmental problems. So talagang I think it's really, I could say almost epidemic proportions, because almost everybody you know knows somebody who has a child with autism or ADHD or other learning problems. And also, the waiting list to have yourself diagnosed with a developmental and behavioral pediatrician could run from 6 months to 2 years. In PGH, our waiting list for new patients is it used to be 2 years in waiting list. Now it's shortened to 1 year.
Okay, doctor, given the enumerated symptoms, is there a standard diagnostic for this? And is this global or the standard of diagnostic? Looking at the different listed symptoms, about 10, when do we say that this is confirmatory diagnostic procedure for autism or ADHD?
Well, the tools that we use and the diagnostic criteria, we use the standards, the international standards, which is the Diagnostic and Statistical Manual, 5th edition na. 5th edition means it has been evolving over time.
So it's a dynamic process.
Yes, it's a
And
dynamic process.
it refers to symptoms have been cropping up along the way. That's why it's a dynamic process. Or there are better diagnostic tools.
No, basically, I think is knowledge in the field is also evolving. So, before, like example, yung autism had 3 criteria, but now it's been narrowed down to 2 criteria. And then they've also recognized that it changes over the lifespan. So there's always a constant debate and discussion. Before, under the umbrella of autism, was Asperger's syndrome. Now, sa 5th edition, they took out Asperger's. And then they just said autism is a spectrum disorder, and you just identify if they're low functioning, if they're moderate functioning, or high functioning. And Asperger, because these are the very, very high functioning, that they're almost normal. So they're not considered to have a condition anymore, because they're practically normal. They're just kind of eccentric and different.
I'm a bit worried if you say that the waiting time for a correct diagnosis is 1 year. I'd like to know what your society is doing, and then I will pass on the question to the secretary later to talk about what are we going to do about this situation.
Yeah, number one, we have only a few professionals really who are trained to make this diagnosis. In our society, we're almost 70, and there are now, I think, 4 training institutions that, from 2 before, Philippine Children's Medical Center and UP PGH, Medical City and De La Salle University have added to the list of training centers. So we need more institutions to train specialists in this field. Okay? And second, over the years, we've realized that the training of individuals, yung specialists for this field, cannot keep up with the pace of increase in the prevalence of these conditions. So we're trying to go public health, meaning what we see is that even if they don't have the exact diagnosis when they're young, when you just say maybe they're delayed, we're already telling general pediatricians, you can do your part. And basically, I think the part is in parenting. You have to train parents and what they can do at home, no matter what this diagnosis is. How can you help stimulate the development of these children? And the role of parents is it's so big. You know, so you really don't need the therapist. For the first 2 to 3 years, the parents play a crucial role in stimulating the development of their child. So parents have to be educated. How can they help these kids? Because the problem is, even if they are identified, the therapists are very few. They're going abroad.
Yeah.
So we have very few therapists. So I think the way to go is to educate parents, to empower them to realize early, what they can do in the early childhood years, to kind of maybe rewire or remold the brains of their children. So that's a big possibility. And even in my practice, what I've seen is, even if these families have therapists, who are the most successful in terms of outcomes of their children are parents who are on board, parents who are also, they learn the techniques and they also become the therapists of their children. So yun ang nakikita kong way to go.
So if one looks at a complete program to lessen perhaps the incidence, I would see that one of the challenges would be perhaps there would be misdiagnosis as well on the part of the physicians because there are very few competent or skilled diagnostician. So, Secretary Pao, levels of healthcare, I would like to ask our secretary herself. At the preventive level would be more early diagnosis, and it would be at the level of household or parenting. And then the second level is promotive care. We really need to promote these things that one must do at the level of the household. And then we have the curative care and then the rehabilitative care. Given the different levels of healthcare, what would be the role of the Department of Health such that there will be less incidents later on?
Yes, actually, addressing incidents is rather problematic at this time because we don't know the cause. It's multifactorial and it really is not yet known to many of us what is the etiology, how come some children have autism, some don't. But what we're trying to address right now in the Department of Health is early detection, so that children who are actually detected early have the chance of early intervention also. And what Dr. MANALO was saying, that it need not be a trained or a skilled specialist like a doctor or a therapist to do the intervention. Maybe the parents, maybe the guardian in some incidents. So what we did try to pilot was the parent skills training. It's a module that the Autism Speaks in the United States, in particular in New York, has been using for their clientele, the persons with autism in the US. And we're trying to adapt those modules into the local dialect. So that's where we are. And hopefully, parents of children with autism, because of their first-hand experience and account, will be the ones teaching other parents. And then in the process, it will be a support group for the entire community. And of course, we're also working with UP and all the other institutions so that we'll have more developmental pediatricians across the country. When we started this intervention in Tacloban, about after Yolanda, 3 or 4 years ago, we didn't have a developmental pediatrician in Tacloban. Now we have. So that's also one of the goals of the Department of Health, to have a developmental pediatrician, at least one per region, and to develop our regional hospitals into child development centers, meaning that these are the facilities where we can have the parents as well as the therapists trained in the regional level.
I am interested to know, is there such a thing as a school-based? You know, the school is the best site to detect, for example, hearing, vision. There's such a thing as school-based prevention. Teachers being taught how to detect the behavior of the pupils inside the classroom relative to other pupils.
I have some issues about making teachers diagnosticians. Because I think the mandate of teachers is that whatever the kind of student you have to help this child learn. So if you're a teacher and you have a child you notice has difficulties in learning, then maybe they should be the ones to suggest you have this child screened with a professional or a specialist. But having teachers also, being diagnosing, also makes them, they discriminate, and they would say, this kid has that, and I don't want that for teachers. I want teachers to be accepting of all children, no matter, maybe they have to be blind to what the diagnosis is, but maybe just try to help these children learn the best way they can.
So let me change the question, because we have hundreds of thousands of teachers out in the field. And if you are allowing parents to come up with a set of questions for screening, wouldn't the workforce of the teachers give you an opportunity to at least pick up some problematic patients for referral? Because right now, if the waiting time is 1 or 2 years, and there are millions of children who need to be screened, we need to find the workforce who will do the screening for us.
Basically, teachers kasi they're able to tell naman which children are sort of different or who have challenges. And then usually it's the parents who know their child more than the teachers. I'd like the teachers more to embrace all children,
Not discriminatory.
Kasi what's happening now, what I see in my practice is that the teachers would say, ay, parang may ADHD yan. Patingnan mo na hindi yan pwede sa school namin. Or else, parang iba siya, may special needs, hindi siya pwede dito. So that's very, it goes against what we want. So, teachers already categorizing, but they should maybe be trained to detect, mukhang there's something different. But not to be the diagnosing this, because what happens is their paradigm changes. They already said, iba siya. And basically, teachers really need more training in behavior management kasi they're trained to teach academic things. But absolutely, they don't know how to deal with the challenging behaviors of children with special needs. And it's not rocket science, because it's easy to train them, but it has to be in their curriculum. Behavior management, understanding behaviors, and addressing these challenging behaviors.
I have a friend, she is a physician, and she was called by the teacher. No? The teacher said, may I talk to the guardian of this boy? Because the parents are working. They're too busy. They can't even look at their children, watch them during the whole day, 8 hours a day. So who would be the one doing that? It's not really the teacher giving them the full responsibility of diagnosing, but perhaps trying to spot some odd behavior relative to the classmates, and then would be in the context of reporting and calling the parents. That's the thinking I think would be very beneficial to add up to this, not really loading the teachers to diagnose, but because children stay in the classroom 8 hours a day, and they have the best, they're in the best position really to observe the pupil.
Commissioner, can I
Yes,
add?
please, Secretary.
Yes, I think one of the things that Stella was saying is that we want a society that's more accepting and less discriminatory, meaning even the teachers or even other members of society, that if there's a child that's unique or different from other children, not to separate them or segregate them, and then they have to have a special school and special training, but to be able to accept that as part of society, a more inclusive society that we have. So that's where the Department of Health is actually coming from. We want to raise awareness. We want to change the way society views these children with autism and with ADHD. In fact, one of the things that we're actually promoting in the Department of Health is to have proportion of our human resource for persons with disability. And in fact, I have a person with autism in my office in the DOH. And we hired him for a particular skill, and he's doing very well. And I think having this person in the office actually also educates the other people in the office, because they adjust to how to deal with him even if he's differently abled. It gives them the opportunity to actually develop their compassionate skills for compassion, for taking care of differently abled persons. So I think that's how we also want to approach it for the Department of Health, to help our people understand the situation and be more inclusive and accepting to differently abled persons.
So that's the promotive care.
Yes.
I have a follow-up question for Secretary Ubial, because I mean, it has been mentioned already that students really spend 8 hours a day in school, and we need to find a way to be able to pick up these problematic students so that the parents can be informed and be brought to the right specialist. So do you see an opportunity for the Department of Health and the Department of Education to partner so that a checklist of questions can be given to teachers so that they can properly refer the patients without necessarily making a diagnosis at that point?
Yes, I think that's one of the things that we are actually working on with DepEd. The school screening program, like for children with errors of refraction. Sometimes we think that the child is intellectually underdeveloped. Ayun pala, malabo lang yung mata.
Yes.
No? And some of the children, they have other issues like maybe long-term or chronic illnesses, which makes it difficult for them to actually attend school on a regular basis. So we have to detect that at the earliest possible time. So I think we're at that. We're trying to develop a screening tool, not just for autism or ADHD, but actually to have annual check-up for all
children,
school children.
Okay.
So that we can ensure that whatever illnesses or possible illnesses they have, these are detected early and interventions are provided.
I just want to mention that about 2 weeks ago, we actually UP launched a program with DepEd on a screening tool for child abuse. Since we don't have enough, I was looking at that model, and since we don't have enough child protection units, they decided to use the teachers just as a screening tool. But I totally understand that they are there to screen and not to make a diagnosis. And we may have to educate our teachers, but that is their role. Their role is, their mandate is to teach and to be accepting, but to be able to identify also these problematic students.
Yes, we agree.
I guess the secret there is especially the preschool teachers, early detection that there is a problem. Because the most challenging part for children with developmental problems is really the intervention in the early years. Because if you do intervention early, what happens is that you increase the possibility that these children will kind of normalize, or they can function in regular society as they grow older. Because when they're young, they need one-on-one intervention. They have a lot of behavioral issues, so that can only be addressed usually one-on-one. That's why we need therapists or the parents. Then as they improve, they can go into a setting of what you call group learning. And of course, mas effective yung smaller groups. And school really is big group learning. So it may not, these children may not be ready for big group learning. But as they improve, usually from my experience, by age 7 or 8, in terms of behavior, they already improve so that they can already be included in a regular school setting. Because what are the benefits of putting these children in group learning or in school? Is their social learning. They learn how to be with other children, how to interact, how the values of sharing, kindness, compassion, cooperation, they can learn that in the school setting. But sana, the school will also make use of that opportunity instead of just be full of just teaching these kids academics. Because these are the values that have to be taught in the classroom. And having children with special needs in a classroom with typical peers will teach these typical children to be more accepting and caring. And teachers shouldn't be in a rush to teach academics. Kasi what I see now is the teachers are so stressed about they have to teach this curriculum, they have to cover so much ground that so many children get left behind. Instead of the other values that, it's the best place to learn these values instead of all these academics and knowledge and facts. Values and interacting and caring for each other, those are the important values that can be learned in school.
I have a question for Dr. Stella, because you did mention, well, one, there is a range, you said. Some are very mild and some are severe. Can you give our viewers an example of maybe a mild form? And then you said that they need a one-on-one intervention. What sort of one-on-one intervention is this?
Well, like yesterday I had some follow-ups of my patients. They're already high school or college. So I remember them when they were 3-year-old.
Okay.
When they're 3-year-old, they're nonverbal. Their behavior was off. They were so hyperactive. And they were delayed. If you measure their skills, they were really delayed. But the intervention that they received, they have occupational therapy, and then later on speech therapy, and the parents are also on board. So every year, these children improve. And actually, by the time they're 5 or 6, they're already verbal. By the time they're 7, they know how to behave, and they can already be integrated in a regular classroom. Of course, like if my patient had autism, there are challenges in the classroom. Because the deficits of a child with autism is they really cannot understand human behavior. They cannot understand social cues. That's an area of difficulty. I'm saying area of difficulty because they can learn it. But they can learn anything as long as it is taught. Okay? So, this patient of mine was actually, because high functioning, could memorize all the facts. So academically, perfect sila in school because their brain is like a video camera. It memorizes everything. The problem they had is with application and comprehension. So if we target that, they get better. And then by high school, they're okay. But in high school, the difficulties really are the social interaction because the complexities of social interaction become more difficult in high school. But if you teach it, you help them over this difficulty, then they actually can learn it. So one of my patients is already in college, history ang kanyang major kasi he memorizes all the dates and all the facts. And I was afraid na baka he's having a hard time adjusting, but he told me he lives in the dorm, and he says, I just adjust to my dorm mates because I realized that they were brought up by different parents with a different set of values, and I was brought up by a different set of parents. So we just have to tolerate each other. So cognitive din yung approach niya to social interaction, but he knows because we taught him. And then the thing is, he writes very well. I was surprised because individuals with autism also have difficulty having a coherent flow of thoughts. So for mga essays and stories, parang they cannot get it organized. But because we targeted sa kanya, we targeted written expression, he won an award for his essay. So he writes very well, he memorizes things, and he can tolerate other people. And he's in a regular tertiary college, doing very well.
Okay, so Dr. Stella, that's for autism. Let's talk about ADHD. Okay, just a mild one. How do you manage this patient at home and then in school?
The most challenging actually sa ADHD is when they're young. Because being young, children are naturally impulsive, they're naturally hyperactive. So those with ADHD just have a parang higher level of this, and they're misunderstood. But as they get older, and you teach the teachers and the parents how to deal with their behaviors, as they get older, by the time they're 7, ang kanilang challenges is no longer behavior, but it's attention and performance in school. So we address this for ADHD, really. The best practice is really for those who will benefit from medications to help them focus. We give it to them. And the milder ADHD, ang problem lang nila is really focus, attention. So if you medicate them, then they have no problems in school. And actually, they're honor students. I have a whole bunch na are honor students, they're not even identified. And then they can, and 50% of those who were diagnosed when they're young, by the time they reach adolescence, parang na-overcome na nila yung difficulties nila. So they no longer have to be diagnosed as having ADHD. But those who are diagnosed later and not treated earlier, nagpa-persist yung symptoms nila up to college, up to the workplace. So those who are mild are actually very normal.
Okay, just listening to what you relayed to us, I want to ask now the secretary, no? I mean, seems like the problem is big and we don't have enough people to make the diagnosis. We have a lot of undiagnosed in the community. In terms of training people, I mean, how far down are we going to go? Local government?
Yes.
Can you give us your
course.
plans for the next couple of years?
Right now, we're developing the Child Development Center in every regional hospital. That's DOH. We have at least 2 hospitals per region. But eventually, we want to bring it down to the province and also the district hospitals. But right now, we can develop the checklist, as you mentioned, for our frontline health workers. That would be the nurses and the midwives. And even probably later on, the barangay health workers, because there's more of them. There's 1 barangay health worker, that's a community volunteer, for every 20 households. So if they have this checklist and they are trained on how to detect probably children with developmental delays, and then we have a service delivery network that actually refers these children to the specialist, then we can have a chance in this country to actually ensure the proper intervention is introduced early enough so that children with autism and ADHD can grow up to be functioning and well-adjusted citizens of this country. But I know that it's an enormous task because the infrastructure is not yet there. We don't have the specialists, we don't have the training that's required, but we hope that with this strategic plan that we actually developed about 3 years ago, that we can move it forward.
So we can say that we have no true picture of this health problem is concerned because we are still looking at the Department of Health program, even to capture those in the community level. And we have seen the role of the teachers. Simple question, Doctora. How about the yayas? You know, the yayas are the one attending to they're the ones attending to the children. Do they have a role here?
They also have to be trained. Sometimes kasi they are the ones who are the cause of the problem. Because the yayas nowadays, they're the millennials. They're the young ones, and these are the ones who are impatient. They're hooked to their gadgets, and they lack the compassion and the commitment actually to really interact with children. I think for young children, the secret is really human interaction. Because they have very little of that nowadays. Parents are busy, yayas on their cell phone, mga kapatid are on their gadgets. So these children, the young children with problems, are left to their own devices, playing by themselves, watching TV by themselves. That will not encourage the development of socio-emotional empathy, which is actually I think one of the major problems in a lot of young children now. Na parang some are actually normal, but because nobody has taught them, nobody has engaged with them, they have no eye contact, they don't know how to talk to people, because nobody's talking to them. So just that alone, even without, you have to understand that the environment plays a big role in how these children develop. So if we just modify this environment, we can already decrease the problem by 50%, I think. Kasi 50% of these kids who are brought to developmental pediatricians, they don't actually have problems. It's the environment that's problematic.
It's even bigger problem now.
Looks like it's a complex thing.
Yes,
Okay,
very complex.
may request, Dr. Manalo, what would you like to say?
Just a final word to our viewers.
You know, all children are capable of learning, no matter what their ability or disability is. And I think all of us just have to give them a chance to learn. The young kids, we have to understand where their behavior is coming from. So if you have delays, like you have delays in communication and language, how else will you express yourself kundi behaviorally? Kaya you're violent, you're physical, because that's the only way you can express yourself. And so instead of getting mad at these children, we have to get to the bottom of this. Why are they behaving this way? They may have a problem, or maybe their environment has a problem. So that's the way we look at these things. Is it the child, is it in the environment, or is it a combination of these two things? The first thing that parents can do is fix the environment. Even without going to a specialist and having the child diagnosed, you can improve this child a lot just by modifying the environment. And that's where parenting comes in. And then if napapersist yung problem, then maybe talaga there are child factors which have to be addressed. And that's where the specialist comes in. And all of these children, no matter what I've seen through my practice, is from delayed, they can become advanced. So let us not judge them early. Let's give them the chance to learn, and we'll see how they come out. But even those who may not be academically inclined, they can learn other ways and in different ways. And they can be very capable and competent. And our country also needs workers, people who work with their hands, not just people who think. So these children have a place later on. Even as people who work with their hands, they do simple work, but that's dignified work.
So talking about people, may we ask Secretary Pau,
Yes,
Filipino community should get from you?
our call is really increasing awareness of our people in the community so that we are more accepting of probably different behaviors. People with developmental delays, we're more accepting. And our call is for the parents and even the guardians, the yaya, the lola, the lolo. If you see something different in your children, sa mga apo, you approach a health worker so that we can help you. Because we're now establishing the service delivery network so that even the children and the communities in the farthest areas of the country, we call the last mile towards universal health care, has access to tertiary care facilities and to specialists. The first step is to get to a health worker or a health center so that we can bring you to the appropriate level of care.
There you are, dear viewers. We are sure that we now have a better and broader understanding of our children and adults with autism and ADHD, as well as their rights that they should enjoy as citizens of our country.
We would like to also thank our local viewers for joining us once more in this Kalusugan ay Karapatan episode.
Thank you, Secretary Ubial.
Thank you.
Thank you, Dr. Stella Manalo. We'll see you again next time for a part 2 on autism and ADHD.